Welcome back everyone. So in this video we will talk about the cough suppressants, which are also known as the antitussives, and we will cover topics including their definition, their classification, their mechanism of action, and then we will talk about some examples like the dextromethorphan, the codeine, and the benzonatate. So the cough suppressants are drugs that reduce the frequency or intensity of cough, and they are used in patients who have dry cough, and in case of the patient having productive cough, then we use the mucolytics and expectorants, which we will explain in the next video. So the cough suppressants are used for dry cough, and the mucolytics and expectorants are used for productive cough. Now let's talk about the cough suppressants classification. So they are classified into central antitussives and peripheral antitussives. Now examples for the central antitussives include the dextromethorphan and the codeine, while examples for the peripheral antitussives include the benzonatate, the camphor, the menthol, and the water steam inhalation. Now the dextromethorphan, which is classified as central antitussive, is what most commonly used out of all the antitussives. Now let's move on to talk about the antitussives mechanism of action. So the cough is produced through stimulation of the sensory receptors of the glossopharyngeal and the vagus nerves, which innervate the mucous membranes in the lower pharynx, the larynx, the trachea, and smaller airways of the respiratory system. Now, when these receptors get stimulated for whatever reason, they transmit a signal to the cough center in the brain, which triggers the cough reflex. Now, the cough reflex results in contraction of the vocal cords to close the glottis, and also the cough reflex triggers the contraction of the respiratory muscles, leading to a sudden increase in the intrathoracic pressure, followed by relaxation of the vocal cords. So the cough reflex leads to closure of the glottis and contraction of the respiratory muscles, which are the diaphragm and the intercostal muscles. So when the respiratory muscles contract on a closed airway, this would lead to sudden increase in the intrathoracic pressure. This is followed by relaxation of the vocal cords, so the glottis would open again, resulting in fast expulsion of air, and that is what we call the coughing. Now the centrally acting antitussives, such as the dextromethorphan and opioids, work by inhibiting the cough center in the brain, while the peripherally acting antitussives work by anesthetizing the sensory nerve endings in the throat, the trachea, and smaller airways. And by these two methods, they inhibit the coughing reflex. Now let's talk about some examples of the cough suppressants, and let's start with the dextromethorphan. So the dextromethorphan is an FDA-approved over-the-counter cough suppressant that works by centrally inhibiting the cough center by unknown mechanism. And the dextromethorphan is a synthetic analog of the codeine. Now the codeine is an opioid medication, and opioids in general are famous for having a strong cough suppressant effect. So the dextromethorphan is a synthetic analog of codeine, but it does not have a direct action on the opioid receptors. So it doesn't produce the classic opioid CNS effects or side effects. Now the dextromethorphan is available as a syrup and a liquid-filled capsules for oral intake, and the dextromethorphan may lead to adverse effects such as nausea and gastrointestinal tract discomfort. And since the dextromethorphan work on the central nervous system, it may lead to central nervous system side effects in form of hallucinations, nystagmus, and dizziness. Now, in high doses, dextromethorphan may lead to euphoria. Now let's talk about the codeine. So the codeine is an opioid that is FDA approved for treatment of pain only, and its use as a cough suppressant is an off-label use. And the codeine works as an agonist on the opioid receptors, the mu, delta, and kappa, and the same as with the other opioids, the codeine inhibits the cough center, leading to antitussive effect. Now the codeine is available as tablets that is taken orally, and it has a lot of adverse effects, same as with the other opioids. So codeine may lead to constipation, nausea, vomiting, sedation, euphoria, central nervous system depression, and central nervous system depression occur more in children. That is why the FDA has warning that the codeine not to be used for cough in patients younger than 12 years old, and codeine may also lead to urinary retention, bronchospasm, tremor, weakness, and of course, the codeine may lead to dependence. Now, the codeine, for its use as a cough suppressant, it is given in lower doses than those required for analgesia, so it produces less side effects when used as a cough suppressant. Finally, let's talk about the benzonatate. So the benzonatate is a peripherally acting cough suppressant, and there is multiple studies that found that there is inadequate evidence to support the effectiveness and safety of this medication in treatment of cough. Now, the benzonatate is thought to work by inhibiting the stretch receptors in the lungs, leading to suppression of the cough reflex. Now, the benzonatate is structurally related to brocaine, and the brocaine is an anesthetic medication. Now, the benzonatate may lead to side effects like sleepiness, dizziness, headache, gastrointestinal tract discomfort, hallucinations, and allergic reactions. And with that, we reached the end of this video. Thank you guys for watching. Please give us a like, comment your ideas and questions, and subscribe.